What's going on, everyone? Happy Wednesday to everyone. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive for COVID or any other virus, I hope you have a full and speedy recovery with no long-term issues. It is time now for the Wednesday edition of the Pandemic Update for Wednesday, November 29th, 2023. First off, if you're new to my channel, welcome to my channel. This is where we do the daily update on all the different viruses, including COVID-19. Yes, the pandemic is still going on. And give me a few minutes of your time. I will prove that to you that there's still COVID going on and a whole bunch of other viruses out there right now. So if at the end of this video you like it, give it a thumbs up and subscribe down below if you learn anything. All right, starting off, remember the mystery virus that we've been hearing about in China? Well, now we're hearing about it here, potentially, in the United States. It says, U.S. city raises alarm over leap in hospital cases as world fears some new illness from China. And it says hospitals in Washington, D.C. are on high alert after a spike in a mysterious respiratory illness, as scientists fear the outbreak from China is spreading. So, basically, it's starting to show up in D.C. hospitals. Let's read a little more. A mysterious respiratory illness is reportedly wreaking havoc in hospitals in Washington, D.C., raising concerns for public health, according to reports. Also, take a look at the red down below. This right here. Breaking news. India now on surveillance after spike in cases of China's mystery pneumonia. So this is something that's starting to gain attention, and I think if it really starts to turn into something, we'll eventually do a dedicated video just for this down the line. Probably not this week, but who knows? I mean, this is a fluid situation. It's changing rapidly, and we're learning more by the day. So stick with my Twitter account and Blue Sky accounts at COVID Data Report or at Data Report on Blue Sky. And anything I see, I will definitely be tweeting on it. Something we really need to pay attention to. And this is also something that really catches my eye today as well. This is over in New Jersey, a long-term care facility nursing home. Admissions halted at Limecrest. So it says Andover Township. Since September, 7 residents have died of COVID-19 at the nursing home, and 66 staff members and residents have tested positive for the virus, an article says. And why is this significant? Well, this is a facility that has historically, since the beginning of the pandemic, not done well with handling outbreaks in their facilities, and they have seen continuous outbreaks, and they have seen continuous deaths, which this is not good. And they are now starting to, the state, I think, is going to step in now. So the State Department of Health has halted admissions at Limecrest Rehabilitation Center in Andover Township and ordered its owners to hire a consultant to run it, Mayor Thomas Walsh said on Monday. So, yeah, it sounds like they're trying to change management here, and they want to kind of figure just what the heck is going on. Why is this place constantly having outbreaks and constantly, just not handling them very well? All right, moving on to this. This is bad news. Cancer patients with COVID at higher risk of death, hospitalization amid the Omicron variant. All right, moving on to this now as well. This is actually somewhat good news. If you want to take it as good news, I guess you could. Scoop. Biden administration sending free COVID tests to schools. So, schools will now have access to COVID tests, and I think this is especially important. Yes, there's the public schools, there's the smaller private schools that you go to day, but you also have these boarding schools, private schools. They're very expensive, and some parents send their kids there, and they actually live at the schools. If you may recall, about a month or two ago, there was an outbreak in Vermont at a private school where a large number of people tested positive, and they were actually running out of COVID testing. So this is a good thing to see schools. Of course, we want all schools to have access to testing, including the public schools where, kids go daily, they go to school and they come home. It just needs to be a thing. But more importantly, I think at some of these private school where kids actually live, yes, they need better access to COVID testing, as does all schools. All right, moving on to this. We're going to do a little bit of a comparison here. First off, I'm going to read to you some numbers. This is the weekly influenza season update from B&O News. Cases, 1.2 million. That's an estimate from the CDC. They're estimating that it went up by 420,000. Hospitalizations, 12,000. That increased by 4,000. In other words, 12,000 so far this season. Deaths so far this season, 740. There were 250 flu deaths last week. Remember that number, especially for you who may be watching that thinks, well, COVID's just the flu, blah, blah, blah. Let me show you something here. Most common strain, H1N1. Pediatric deaths, that actually went up by 2, and we do know there was one out in, I believe it was Arizona. Now let's come over here to COVID again. So remember what we just said, I'm going to repeat it. Deaths, 740 so far, 250 last week. But now you're thinking, well, wait a second, if COVID's just a flu. Well, here's COVID deaths last week. 1,305, and that number is still elevated from the summer wave. This is a 1 week number. That's from the summer wave, and now we're already building upon that. 1,305 COVID deaths, 250 flu deaths. Yeah, COVID is not just the flu. Sorry, thanks for playing, but yet you lose. It's not. There's no argument to be made here. COVID is way more deaths than the flu right now. So, yeah, there you go. Once again, 250 flu deaths and 1,305 COVID deaths, which, oh, by the way, you're thinking, well, they're counting some flu deaths. No, they're not. Nope. This is on top of the flu deaths. So, yeah, what is that? 1,500, over 1,500 deaths just from COVID and flu in 1 week? Yeah, that's not good. And it's something that N95 masking can help prevent. All right, moving on to this. I tweeted this last night, and boy, did it blow up. 65.6 thousand views, over 1,900 likes were given. So, yeah, this is pretty significant. I said it before, I will say it again. Uber should have a masked ride option for those who want a masked ride. And I then put another comment down below how Lyft should as well. If you're not familiar, Uber has an option on their platform. It's not in all markets, but we do have it in my market here in Philadelphia area where there's an Uber Pet option. I hardly ever see a request pop up for the Uber Pet. Mind you, I don't do rides for people right now through the apps. I just do deliveries, but it pays to have Uber Pet on at the same time. I'm not going to explain why, but the point is, there's hardly ever any requests for it. I'm willing to bet if they had a masked driver option where the rider has to mask and the driver shows up masked, it would get requests. I mean, over 1,900 likes and counting, will probably go over 2,000. Yeah, that's making a statement right there that, hey, maybe they should have a masked driver option on both Uber and Lyft. I think at least in the big city markets it would work. I don't think it would work in rural America because we know how they feel about masking, but no offense to rural America. If you master, that's fantastic. But I'm just saying in the major metro cities, I think they ought to test it out because I think it would work, and I think it's a source of revenue that Uber is missing out on. Lyft as well. All right, moving on. Let's take a look at today's check on air quality, and to be honest with you, it's not terrible, but you still are going to see the West Coast. Yeah, look at this. The West Coast still has poor air quality. And take a look over here in Michigan, Chicago, Wisconsin. I have to think some of that is maybe people using their fireplaces because of people trying to heat buildings and houses. I mean, that does release a lot of smoke into the air and whatnot, steam. So maybe that's what's going on here. West Coast, probably the similar deal. However, I do take note of this. You come down to Louisiana and Houston, still some poor air quality. I don't know what the deal is for that. Is there smoke ongoing there? There was smoke there a month ago. I don't know if that's continuing to be a thing. Let's take a look at Walgreens. The national positivity is 28.3%. Prior week was 27.9%. Difference of up 0.4%. Let's take a look at 4 states. Number 1, New York State. Why are we looking at New York State? Well, when you see New York data a little bit, it's not too great. It's not good at all, actually. Current week, 38.9%. That is down 3% from 41.9%. Total tests, 355. Prior week, 375. But sometimes you just cannot go with the Walgreens data. I'll explain about that in just a little bit. Tennessee, 31.2% this week. That's a 4.9% increase from 26.3% last week. Total test, 404 prior week, 502. Now let's come out to Montana. 25% this week. That's up by 16.7%. Testing slight. Yeah, that's a legitimate rise. And let's also come down here to Texas if we can. We got data from Texas today. And Texas is down ever so slightly, 21.9% versus 22.4%. Total test is 2,068, so testing's down as well, and you're going to see there's actually data that supports that maybe Texas actually had a small drop. I'll show you in Texas numbers in just a little bit. All right, I have to show you this. This is the latest variance. HV.1 is at 31.7%, EG.5 is at 13.1%, and finally, BA 2.86 has been added at 8.8%. All right, now we come over to this, something a little bit different. The CDC has made a few changes. This is not one of them, although I do want to show this to you. COVID hospital admissions in the past week, 18,119, and you can see here in the orange and the lighter shade, the bright orange and the lighter shade of oranges are moderate to substantial increases in hospitalizations, and you can see there are a lot of places across the country that is seeing large increases. Like, for example, we come up here to Pennsylvania. There's Center County, Pennsylvania. Total of 15 hospitalizations now. Then you come down to, like, southeast Pennsylvania, and you can see here new emissions of COVID-19. Just look at this, Philadelphia, 318. That's a 17.8% increase. Then we come down here to the different counties in California, and you can see here California is seeing an increase, 16% increase. So yes, there are quite a few increases in COVID around the different areas. So yes, it's something that we have to watch, and unfortunately it is concerning. But then we come over here to wastewater, and the CDC, yes, they still do the wastewater sites, but let's come to this now. And I will show you here now. Look at this. We can do a region by region look at the CDC data. Select a category to add or remove it from visualization. Anywho, take a look at this. We can see where wastewater is rising or dropping. The West Coast, CDC has it dropping. The Northeast, significant rise. The South, starting to rise. Midwest, look at that. Midwest is rapidly rising now. And we see on the national level that there is somewhat of a rise going on at this time. Then we can click on this and take a look at the wastewater levels on a state level. Now, unfortunately, we still can't see Oregon and several other states, but we can see a lot of states. And take a look here. Very high levels of COVID in wastewater in Virginia right now. Very high levels in Iowa, Minnesota. Vermont's coming up with high levels. And high levels also, well, very high levels in Vermont, but high levels, which is a step lower, in New York State. You can see moderate levels in Texas. Florida, believe it or not, is still low. I suspect by the middle of December, Florida will rapidly start to go up. All right, let's take a look at some state and city data now. We can see Philadelphia yesterday had 746 EMS incidents. Let's do a live look in on Montgomery County. Thankfully, not as busy as it was about an hour or two ago when there were upwards of 24 incidents at once. Chester County still has quite a few incidents going on, and I'm seeing several heart problems and several respiratory issue calls and multiple sick calls as well, so that is not good. New Jersey, 537 COVID hospitalizations today, 16 on a ventilator, 52 people now in the ICU. Discharges, they had 98 of them. That's quite a few. 67 out of 70 hospitals are reporting. New York State, 1,782 new cases. Then we come over to New York State COVID hospitalizations, which is not good. It's now 1,430 people in the hospital. And remember, they ended the week last week at 1,207. So this is a big increase. Again, which is why I said we were looking at the Walgreens data. I'm going, New York State data does not support there being any sort of a drop in New York State right now. The hospitalizations, they just started to, you might as well say, explode in New York State. All right, we also got Texas data today, so this is good. In Texas, we can see the confirmed cases are actually down, 2,711. Current week is 7,793, 10,504 the previous week. Again, that's over 2,700 decrease. Here's where it is bad, though. the number of deaths are up. 7 increased. So it's 45 versus 38, which makes 7 more. Hospitalizations down ever so slightly, down by 33. 960 versus 993. Hospitalized, the average is still over 1,000, but should this continue, I don't think it will because of the post-Thanksgiving surge and winter surge, but should this continue, that's not a terrible thing to see them dropping, and it's good news to see the cases dropping, but you gotta wonder, was testing down in Texas last week? Hard to say, because we don't see a positivity rate here anymore. Alrighty, guys, that does it for today's pandemic update. We'll have another pandemic update again tomorrow. And of course, if any news pops up about this new mysterious virus that is popping up in several different countries, and yes, as you saw, now in Washington, D.C., I will tweet it out and I will also post it on Blue Sky. Alrighty, folks, that was a lot of information, wasn't it? If you learned anything or liked this video, give it a thumbs up. And especially if you learned anything and want to see more of this content, subscribe down below and share this with your friends, family. The whole goal is to help keep you and your loved ones and friends safe. I will see you all again next time. But until I see you again next time, stay safe, everyone, and have a fantastic Wednesday afternoon.